Hi, good afternoon. My name is Paula Williams. Today I will be demonstrating the procedure of how to do gram stain. What is gram stain? Gram stain is mostly commonly used technique that we use to differentiate the difference between gram negative and gram positive bacteria cell. The difference between gram negative and gram positive bacteria cell is that gram negative bacteria are pink in color and surrounded by a very thin peptidoglycan cell wall which has an outer membrane containing liposaccharide, whereas in gram positive bacteria are purple in color and lack an outer membrane but are surrounded by layers of peptidoglycan many times thicker than the one in gram negative cell wall. There are multiple steps we have to take to do the gram stain procedure. Now, step 1. This is to prepare a smear slide with mixture of two bacteria colonies. For example, strep and bacillus bacteria. Step 2. We will apply a primary stain called crystal violet. You will pour the crystal violet over the smear slide for 1 minute, guys. That's it, just 1 minute. And then rinse it off with tap water. This will stain both the bacteria cell in a purple color. Step 3, we will apply the iodine solution. We will pour the iodine solution over a smear slide for 1 minute again, guys. You gotta pay attention. This is very important. 1 minute. Rinse it off with tap water. This negatively charged iodine molecule will act like a mordant and will trap the crystal violet to the cell wall. Now, step 4, we will use a decolorizer. The decolorizer that we will use is 95% alcohol. That we will pour over the slide for 2 to 3 seconds and rinse off again with tap water. Now, the purpose for this step is to wash off the crystal violet from the gram negative bacteria, but the gram positive bacteria will still remain purple, guys. It won't change that. Step 5, we will use a counter stain called safranin. We will pour the safranin over the slide and leave it on for 1 minute and then rinse off with tap water. We always use tap water to rinse off. Excuse me. To rinse off the excuse me. The gram negative will pick up the dye because of its thin peptidoglycan cell wall and stain it pink in color, while the gram positive will remain purple. Next, you will block dry and view it on a high power oil immersion on 100 times under microscope, where you will be able to differentiate between gram negative and gram positive bacteria. This is very important. We need to know the difference. In the clinical settings, the gram stain is very, very important, guys. This is how we use to tell if you what kind of bacteria you have and how the doctors treat it. Now, this is very important because the doctor have to diagnose and treat his patient very, very keen. You got to be very, careful. He needs to know what type of bacteria he's dealing with. Yes, this is very important. Whether it is gram negative or gram positive, it is very important. The lab now will have to perform a gram stain procedure to be able to identify excuse me, to be able to identify and differentiate whether the patient have a gram negative or gram positive bacteria. The gram stain procedure can also differentiate the shape of the bacteria we are dealing with. With, excuse me, as well knowing the shape and type of bacteria we are dealing with. The doctor can properly treat his patient with the right antibiotic for their symptoms. Thank you.